Hi, my bees. My name is Dr. Stefani Kappel and I'm a board-certified fellowship-trained cosmetic dermatologist in Newport Beach, California. And today I wanted to do a video trying to help you guys find the right provider when it comes to aesthetic procedures. And this has probably been my most requested video that anyone's ever asked me, and I get a ton of comments and questions asking me to do this video. And the reason why I haven't really done it so far is because it's hard to, there's no real cookie cutter formula or one thing that I can say that will ensure that you'll be in the right hands. But what I can do is kind of give you things to look for when trying to find a provider for you. And then also, whether you're looking online to try to find someone or whether you actually meet that provider in person before you actually do a procedure with him or her, kind of like what questions to ask to feel them out to see if they're the right provider for you. So before I move on, I ask that you like, subscribe, and share this channel with anyone who wants non-sponsored content from a board-certified dermatologist. I feel like that's hard to find on YouTube these days. You won't see any coupon codes or affiliate codes on my YouTube channel. I literally only recommend what I truly feel is best for my patients, and that may change when something better comes along. And I just love the freedom that I've been able to do that, and I will stay true to that. So I'm in my office. We just finished seeing patients, and you can see the lasers behind me. I'm 100% cosmetic and highly trained to just perform aesthetic and cosmetic dermatologic procedures, and that's 100% of what I do. So YouTube is just kind of a thing that I do on the side just to educate you guys, but I'm in the office here using these devices, using these lasers, and treating patients every day, and I love it, and it's my true passion. Okay, so what are the top things that you should look for when you're trying to find a provider for you? And I think number one is their level of training. And again, I'm not saying that they have to do a dermatology residency and be board certified in dermatology or plastic surgery or oculoplastics and then have a fellowship on top of that and then another fellowship. You don't have to look for that, but some type of training. And it doesn't matter if they're an MD or they're a nurse or they're maybe an extender that doesn't have, the qualifications that, you may think would be necessary. It's all about your experience and your level of training. So don't get hung up on, whether it's a nurse or a doctor. A lot of people ask me that all the time because in my office, Dr. Kennedy and I are the ones seeing and treating patients. But I'd be very comfortable having a nurse injector with me if he or she had the level of training necessary to be comfortable and really understand these aesthetic procedures. So training courses also can vary. The ones that you really want to look for are people that are affiliated with the ASDS, which is American Society for Dermatologic Surgery, with ASLMS, which is the American Society for Laser Medicine and Surgery, and the AAD, which is the American Academy of Dermatology. And most of these societies have meetings once a year or sometimes biannually, and they have really extensive laser and injectable courses held for nurse providers or extenders or other physicians that are in other specialties that want to cross over and get into the cosmetic dermatology space. And these are the experts who are running these programs in these highly regarded training programs. So I just kind of like for fun Googled last night, injection courses. I mean, I saw a ton of them like pop up. They're not all good. Most of them, I would say 90% of them are just ridiculous. They're going to charge you money, and it's like the blind leading the blind. The people that are holding these injection courses to make money don't even know how to inject themselves. So they're propagating these bad habits. I went to go teach at a med spa the other day. This injector was having trouble, and she went right in. I'm like, show me how you do. She wanted to learn how to do nasolabial filler, which is actually pretty, it's not that complicated of a technique. But she went right into the apical triangle, right into an area which was very high risk. And I said, who taught you how to inject this? I mean, her bevel was down. I can get into it, but she didn't even HIPAA cleanse before she injected. But there were a lot of mistakes that she made. And I'm like, who taught you this? And she's like, oh, I went to such and such course. And I'm like, that person doesn't know what they're doing either. So knowing what training courses to go to or what to look for, what training courses your provider has gone to, look for those. AAD, ASDS, ASLMS. And then, and of course, if they're a board certified dermatologist who's done a fellowship, of course, that's your safest bet. But, that's not necessary. That's only if you really want to go to the tippy top. But of course, that's not going to be totally necessary. But an injector who's done a really reputable course, not just some, YouTube online course or some Instagram course that was given by somebody who doesn't know what they're doing in the first place. So always check their level of training because some people will start getting into aesthetics and practicing these procedures without having any experience at all. So any experience is better than none. I had a patient of mine just a few weeks ago who just graduated from nursing school, and she's like, oh, Dr. Kappel, I really want to get into aesthetics and I want to start doing injections. And she goes, what courses would you recommend? So I recommended some of the courses that I just mentioned to you, and then there's another one called Palette, which is really good too. And there may be, a few days worth of the course, and do like a couple of them, or do it once a year, or just do something. Don't just start injecting people without any formal training, because that's just a recipe for disaster. But the patient was like, ooh, she's like, I would do that course, but it's like a 3-day course and it's in New York and it's like $2,000. And I'm like, okay, so she's talking to somebody who went to school for 20 years just to do this. Hard to, empathize with someone who doesn't want to take 3 days and $2,000 to invest in a course that's going to better themselves and their career, better their techniques, and be safer for their patients. It's really hard for me to fathom how somebody couldn't even put that amount of time into it. So they shouldn't be treating you, if you're a patient, if they're not going to take responsibility and do, a training course that's reputable, or where they're actually going to learn something, their anatomy, the dermal planes. If you're talking about a laser course, the difference between all the different lasers and how to treat different skin types and skin of color, and the different settings to use, and you can't cram 15 years of school in 3 days. And you would not be able to tell the difference between somebody who's been through a 3-day course or 15 years of school sometimes from someone's website, or from their Yelp reviews, or from their Instagram or social media pages. And that's the problem. So don't be afraid to ask your provider, if you meet him or her in person, where did you learn how to do this? Did you just YouTube this in the break room like 2 minutes before I got here and I'm your first one? Or have you, because you'd be surprised, you guys, I'm serious. You guys are probably thinking I'm exaggerating, but I see it all the time, because those are the people who have complications. But don't be afraid to ask that. And then also ask, how long have you been doing this? Did you just start doing this a month ago? And that's okay if they have, and they disclose that, and maybe they have somebody mentoring them and proctoring them. But I probably would go to somebody who's been doing this for, honestly, at least 5 years. I hate to say that, because I don't want to hurt business for anybody who's a newer injector and has been doing it than less than 5 years. But with that amount of time, you kind of learn the ropes, and you're comfortable and you're familiar with the treatments, whether it's a laser, an injectable, peels, all the things in aesthetics dermatology. So those are the questions to ask. Also ask to see their before and afters, and it must be their own before and afters. I've seen my before and afters posted on other people's Instagrams, and I have to, contact them, and I don't have my before and afters watermarked. I probably should, but other people will use other people's before and afters as if it's their work, because they don't have any before and afters, because they haven't been doing it for a long time. And again, there's no regulation or accountability out there, you guys. Hopefully someday there will be. I think the American Board of Dermatology and the American Academy of Dermatology are working on this, because it's just these people infiltrating our specialty and just claiming to be experts and hurting people is getting so out of control at this point that I think some type of regulation needs to occur. So I think that's coming down the pipeline, but it does not exist now. So don't be afraid to ask your provider these questions. What I've learned being in this industry for a very long time is that the aesthetic space is a little bit different than other areas of medicine. Usually when a physician is practicing in a hospital, they have to provide hospital privileges in order to perform certain surgeries in the OR and so forth. But dermatology and cosmetic dermatology is in this kind of gray area where you're kind of in the beauty industry, but you're still medical, but the same rules don't apply. So anyone pretty much can open a med spa and start doing injectables and hire a bunch of extenders who may also not really know what they're doing, and they're treating patients, cash paying patients who may be getting a first-time injector, and they don't realize that. So I feel that, I've been in this industry a long time. I've been on a path to become a dermatologist since I was about 17 or 18 years old. As a pre-med, in college, I knew I wanted to be a dermatologist, and I've always been obsessed with skin and lasers and injectables and things of that nature, even when I was just a kid myself. But the traditional path that I got to get here, not many people have. So it's just really interesting for my colleagues and I, who have gone through a dermatology residency and a procedural dermatology fellowship, and have been at the podium and giving lectures and, traveling worldwide and teaching other doctors how to perform these procedures. It's amazing to see how many people are doing this that really haven't had the appropriate training. And the problem is that they don't usually disclose that to patients. You'll see their Instagrams popping off. You'll see their YouTube channel is, has, I don't know how many hundreds of thousands of subscribers, probably because they're in contract with, a company in exchange for subscribers. It's just gotten so contaminated. And over the years, I just, see complications, and I see less than desirable outcomes. But the problem is that there's no checks and balances systems like there are in other areas of medicine. Anybody could just open them. You can be a cardiothoracic surgeon and open a Botox clinic and have lasers and I'm leading the blind, but the problem is that people get hurt and complications happen, and then sometimes those results get propagated on social media and on the internet, and then people get afraid to have these procedures done, but that shouldn't happen. So there's no way I can prevent people from doing the wrong thing, but what I can do is educate and empower patients and my viewers and my subscribers and my followers to be empowered to know what questions to ask, what red flags to look out for, and to know what is going on behind the scenes in aesthetic dermatology and cosmetic dermatology, because you'd be surprised. And I see the bad and the ugly because I'm the one who gets the referrals when things go wrong and I have to reverse these complications. And although they're, not usually the most, life-threatening complications, like say you get a dropped lid from Botox or an asymmetric smile, there can be blindness, there can be stroke, there could be permanent laser scarring that's irreversible, that's going to disfigure someone for the rest of their life. I mean, these are the things that we see, and that doesn't get posted, and maybe it should, because it all comes from not having enough training or taking the proper route to get into the aesthetic space. It's usually maybe, a burnt out family practice doctor who is just not wanting to practice family medicine anymore. There's no money in it, and they want to open a med spa, which is much more lucrative, and just start doing Botox and have a bunch of extenders who actually may have more training than they do to kind of oversee this med spa while they're not even in the office. And it's just astounding to what is happening. So I want to bring it back to center, kind of remind newer injectors that you have an ethical and moral responsibility to educate yourself. And I'm not saying you have to go to 20 years of school like I did or my colleagues did in order to do this. That's totally unnecessary. But take at least a few training courses and don't practice on your patient. And you can feel it out. And sometimes it takes actually talking to your provider in person, not just doing an online search, because online credentials can be really deceiving. You can have a CCU nurse who's been in the critical care unit for 20 years who wants to open a med spa. Before, doctors were only allowed to open med spas, but now doctorates of nursing, which they introduce themselves as doctors, even though they're nurses, which is fine, but I can be misleading to patients, so just so you know. And they'll say, well, I've been practicing medicine and in this industry for 20 years, even if it's their first week of doing aesthetics, but they're kind of capitalizing on the 20 years of experience they had in the CCU. And it's just like, I see that all the time as well. And so I just feel like for newer injectors or people who are new to the aesthetic space as providers, you have a moral and ethical responsibility to disclose to your patients how little of time you've been doing this. And that's okay. And people sometimes, I remember when I was learning as a dermatology resident, I had my first couple of patients that I ever had to treat too. And they knew that we were learning, and we said that, we had an attending behind us watching every move we made. And we would say, this is our first time injecting. And you had a conversation with the person training you. Okay, do I inject here? Or how deep do I go? How many units do I do? Just things of that nature. And that's how we learned. But the patients were accepting and understanding of it because they were in they were at UCLA in the residency clinic, so they knew that they were what they were getting into. But I do feel that it's not a bad thing if you're just learning, and you have to disclose to maybe your first 100, 200, 500 patients that, hey, I'm still new at this, my prices are a little bit lower to kind of compensate for that, and forgive me if anything it goes wrong, but this is my first time and I'm just kind of learning. And I do feel that people are so ashamed to say that, and they just want to break out the gate and start making money and start having higher prices when they don't have the qualifications or the caliber to do so. And that's when patients get hurt. And another thing that it's important to keep in mind is that you want to go to a provider for whatever treatment you're getting. You want to make sure that they're an expert in that field. For example, if you go to an injector who you really love, and he or she's been doing your Botox and your filler for 2 years, but you want to have a laser, and their new clinic just got a new laser, you don't want that same person to be doing a laser. You want the laser specialist to be doing your laser, the injection expert doing your injections, unless of course you have a fellowship trained dermatologist or somebody who's spent 15 years of school. We get everything. We know how to do everything. Our armamentarium, we're loaded and ready to go, and we can handle anything. But for somebody who is maybe a lesser tiered qualified provider, I'm sure that they're probably just more focused on just injectables or just lasers or just another type of treatment like an energy-based device or thread lifts or whatever. So just ask, don't get roped into an office because you like that injector and you're going to get a laser there. Go to the laser specialist for your laser, go to the injection specialist for injectables, unless of course they're a plastic surgeon, a dermatologist, or oculoplastic core. That we call those the core specialties because we get it all in our training. So just make sure that you're going to the right person for the right treatment that you're going for. And then also, if you're a little bit more hesitant because, say for example, you're more high risk at a complication happening, like say you have low platelets and you're more at risk for bruising, or say you're a darker skin tone like a Fitzpatrick 5 or 6 and you want a laser, or say that you have really sensitive skin and you just react to just something as simple as HIBA cleansing, the cleaning the skin before a procedure. Those are the people that probably for their first time having a treatment will want to go to a very highly trained individual. I'm not saying that everyone needs to do that. I'm not saying that you need to do that for every procedure that you get, but sometimes people will fly in to see me just for a day so that I can write out the protocol or what lasers I would do. Say for example, what lasers I would do on them, what combination of lasers would I do, what settings I would use for them, and we'll together at a consultation kind of come out with a treatment plan, and then he or she can take that to a provider near them who may not have that expertise, and I can talk to him or her about it, or we can share notes. The other thing that I wanted to mention is, I know I mentioned before that there's no difference between MD and a nurse when it comes to being a provider. And I really can't hit this home enough, because I see a lot of people will say, well, I'd rather go to an MD. When sometimes the MD is basically, a retired pediatrician who's been doing pediatrics for 20 or 30 years and is just now starting Botox. Or you'll have a nurse injector who graduated from nursing school and from day one has been taking courses in injection courses and is a much better injector than the physician is. So there's no, don't worry about that. Don't worry about credentials. The only one caveat I have about that is estheticians, because estheticians are incredible at what they do, giving facials and optimizing skin health and getting treatment plans for different topicals. But even in the state of California, they require 100 hours of education. And you can't compare 100 hours to 20 years, or 15 years. You just can't. And sometimes some of my greatest complications have happened when estheticians have performed lasers or, even broadband light, which is not truly a laser, but, kind of like a broadband light device, or an IPL, intense pulse light, with a chemical peel, with other actives. And I'd actually just had a patient just a couple weeks ago who had like 3rd-degree burns on her face from this happening. So in some states, estheticians are allowed to do certain procedures like that, and the procedures that they're trained to do, they're phenomenal at. And actually, I recommend highly my patients have regular facials, hydrofacials by esthetician states. They're doing thread lifts, surgeries, like all kinds of crazy things. So it's the Wild West out there. So just protect yourself and don't be afraid to ask, so how long have you been doing this, and are you trained to do this? And don't get offended. Don't let people get offended or make you feel uncomfortable asking these questions, because people come into my office all the time and they question me about where I went to medical school, where I went to residency, where I did my fellowship, and when I was a professor at UCLA, how long was I there for? And they ask me a ton of questions, and I love it. I'm happy that they're valuing that and that they're asking me about my credentials. They should be. And so don't be afraid to ask your provider things like that. Where did you go to school? How long have you been doing this? And if they're feeling uncomfortable, or if they're making you feel uncomfortable for asking them those questions, that should be a red flag that they're hiding something, or they're reserved and they don't want you to know how little training they actually have, and just run out the door. And last but not least, what does fellowship trained mean anyway? Everybody always says that. Dr. Kappel, you say you're board certified fellowship trained. So a fellowship is just an extra year or sometimes 2 years of training where a dermatologist, after completing residency, will do a procedural dermatology fellowship. Now, I did mine in a combination of laser medicine, cosmetics, and Mohs micrographic surgery. And so you basically have a year where it's called an ACGME accredited fellowship. It's basically you and your mentor, who is usually an expert in the field of laser medicine, Mohs surgery, or cosmetic dermatology, and you basically are proctored, and you do thousands and thousands and thousands of cases, and you do it with your fellowship director behind your back, breathing down your throat, making sure that you're doing everything correctly, and questioning you, asking you questions, and assessing you, redirecting you, correcting you. So it's just a really intense one-on-one experience where you have to log in. I remember every day after clinic, you have to log into your ACGME courses, what you've done that day, and you have to, in order to pass your fellowship, you have to have I can't even remember now, but it was 1,000 laser not even just laser, but 1,000 V-beam lasers, 1,000 Fraxel lasers, 1,000 clear and brilliant lasers, 1,000, high G prime injectable fillers, 1,000 low G prime injectable fillers, 1,000 thread lifts. It's just, or 100 of this or 100 of that. So you basically are seeing thousands of patients and you're logging them all in, and then you pass your fellowship, and that just seals the deal. Then if somebody's done a fellowship that they are very highly trained and have a lot of experience and have been mentored and groomed to be very good at what they do. And why would somebody do a fellowship after completing a dermatology residency? The reason is because, in my case, I wanted to take an academic position. I thought I wanted to go into academics because I love teaching and I loved being a professor of dermatology at UCLA. I just really love teaching the med students and the residents, but I also wanted my own practice and credentialing. But a lot of people will do a fellowship because their residency training may not have had exposure to a lot of aesthetics in their residency program. So I don't know how many residency dermatology programs there are in the country. I think maybe, I want to say between 90 and 100. I don't know. It changes every year. But when I applied, I believe that there was about 90 programs. And, programs can be highly variable depending on their location. For example, I live in California. I was at UCLA. There was 3 of us in our residency program, so they took 3 applicants a year. I was very lucky to land that spot. It was like the happiest day of my life. Our first day of residency, we were injecting Botox, injecting fillers. I fired a Fraxel laser my very first day of residency, and we were in the heart of West LA, so I completed my dermatology residency at UCLA, which at the time was like a top 3 program. It was my dream school, and I had to pinch myself when I matched there. I got very lucky. To this day, it was one of the happiest days of my life when I matched there, because they only took 3 applicants. I don't know how many thousands of applicants applied for that position, but I was lucky enough to match there. And in my residency program, we got a lot of aesthetics, and we were injecting Botox, and I even did like a couple Fraxel treatments my very first day of residency as a first year. So we had a very high level of exposure to aesthetics and cosmetic dermatology, where some programs like USC, who's just our crosstown rivals, they were doing more medical dermatology, and they didn't really get much aesthetics at all. So, it depends. If you're in a dermatology program in the Midwest or in an area that's, not Miami or LA or New York, you're not going to be getting the amount of aesthetics and cosmetic dermatology training in your curriculum. So then you want to go on and do an added year of fellowship where you get nothing but cosmetics to kind of make up for that fact. Because even though we get tested on it on our boards and we may get it in our didactics, some people will graduate a dermatology residency and never have injected a patient with Botox. So, that's just the reason why they have fellowships, or for people who want to just get a little bit extra training. But it's always great to look for somebody who's fellowship trained if you're looking for a higher caliber of provider. But again, that's definitely not necessary, and we are few and far between. So I don't want you to stress out by having to have a fellowship, fellowship trained provider. But just, if you're really looking for like the top, that's where you'd want to go. But the real point that I wanted to hit home is that it really doesn't matter what credentials you have, as long as you've taken training courses and you have experience, or at least some experience under your belt, and you can have befores and afters to provide to your patients, and just be honest, be honest with each other. For the patients seeking the provider, say, how comfortable are you with this? How long have you really been doing this? And for the provider, say, hey, I've been a NICU nurse for 10 years, and I really love aesthetics, and I don't have that much practice, but I'm just opening this med spa now, and I really want to gain your trust, and you're going to be one of the first patients that I treat. And if the patient doesn't want to get treated, then that's totally fine, and that's okay. It's not right to cover that up or be misleading. And if I can't hit anything home in this video, I really at least want to hit that home, because we all have that moral responsibility and ethical responsibility as providers, which I think has been lost over time. So in looking online and looking at credentials, just kind of, if you're on somebody's Instagram or their website, and just look for, where they went to school. If they're a physician, see, where they went to school, what type of residency they did, because if they're like, I'm board certified dermatologist in practice over 20 years, they could be board certified in family medicine, choosing to practice aesthetic dermatology, and they've been only doing it for a few days, and they've been doing their other specialty for like 10, 20 years. So I always see also, like on social media, sometimes people saying, we have a new injector in the office. She was an ER nurse and worked in critical care for 5 years. Well, like, great if you're having a heart attack, but that doesn't mean you know what laser settings to pick out for your patients with a darker skin type. So it's just, you have to just not not be, I guess, I don't want to say fooled, but you don't want a misleading credential to throw you off where you're actually having somebody who really doesn't know what they're doing just because they were, an intensivist or a critical care, nurse for 10 years. I mean, yeah. So in summary, training, experience, expertise, and before and afters. I think those are the 4 most important things to look for when you're trying to find a provider. Don't be afraid to have the conversation with them. And also when you're looking in someone's credentials, if you can see, American Academy of Dermatology, the American Society for Laser Medicine and Surgery, and or PALET, which is another great training course, or ASLMS, American Society for Dermatologic Surgery. Look for those credentials, and I think that you'll be definitely in a good spot. You can also drop a comment in my comment section, and if I forgot anything in this video that you guys wanted to hear about or would be helpful in helping you find the right provider, let me know. Also, if you live in an area where there's not a lot of providers to choose from, don't be afraid to fly out and see an expert. And if you want to know who the experts are, look at those academic meetings, the ASLMS and ASDS and the AAD, and look at the people who are giving those lectures, because those experts who are giving the lectures were all at the podium. Those are the people that you maybe want to see and have just one-time consultation with, and then kind of get it in the back of your mind what a safe treatment plan would be, and then go to a provider who's more local, who you can trust and kind of share these ideas with. So I hope this is informative. I hope this helps you guys. I don't know if this is going to be helpful or not, but I don't know how else to recommend a provider that you can trust, because this industry is so contaminated with people who probably shouldn't be performing these procedures. I hate to say it and I hate to be negative, but that's just truth, you guys, and that's why it took me so long to do this video. All right, I love you guys. I really do. Stay safe, stay well, and I will see you next week.